So the way that we put patients across the medical board, the way that we put patients on semaglutide is to titrate them, which means to start with 0.25 milligrams, max dose would be 2.4. So we'll meet with the patients once a month, every month, and at each check-in, we ask you, what side effects are you having? Are you having any nausea? Are you constipated? Are you having any diarrhea? If they are, we talk about how we can mitigate or kind of lessen those symptoms. And if they're tolerating the therapy well, and we think that there's room for improvement and how much weight they're losing, we'll increase that dose. And the normal titration schedule is to double the dose every time. So you'd come in the first, appointment with me, we make sure the drug is right for you, and then we're doubling the dose next time we see you, so long as you're tolerating it well. The theory is, the higher the dose you're on, the better it will work. But not everybody needs to get up to the 2.4. Oftentimes patients see great results in a half to 1 milligram, honestly. The average patient will come in once a month, every month. There are some patients who will choose to come in maybe in between the first month and the second month. So when a patient comes in for a semaglutide appointment or check-in at the front desk, we'll bring them back to our infusion kind of semaglutide consultation room, which we're in right now. We'll have them change into a gown, and then they'll clean their hands and feet with a wipe that kind of helps with the conductivity for the in-body scan, which the in-body scan is a body composition scan here. It breaks down your skeletal muscle mass, your total body water versus your extracellular body water. It'll break down your percent body fat, and it actually looks at the muscle makeup in your left arm versus your right arm, your left leg versus your right leg, to make sure you're symmetric. And then it will kind of show you a breakdown of where you're storing your adipose tissue, which is just fat tissue. And so it's really kind of cool to see patients, the adipose tissue within their trunk or their belly, and kind of see how it trends down over time. You'll do your body composition scan when you come in, change back into your normal clothes, and that's when I come in and we kind of discuss how things have been going, how you're feeling, if there are any side effects we need to work with. We'll go over your in-body scan together, and it's a really great cheerleading moment. Also, it's really fun to tell patients no, 7-pound weight loss in a month is pretty freaking great. So we'll kind of talk about your results, and then we drop the medicine and you get to check out and leave. It's honestly a very quick appointment, maybe 15 or 20 minutes tops, all said and done.